Good afternoon, everyone. I'm joined today by the Minister for Aged Care and the Minister for Sport and for Ageing, Richard Colbeck, and of course, as always, by Professor Brendan Murphy, the Chief Medical Officer. It's been another very productive meeting of the National Cabinet today. And importantly today, we discussed many issues, both from the economic front as well as on the health front. Success during the COVID-19 pandemic is not just about containing the virus and having low numbers of cases. It is true that we have had some real success on the health front. There are now only around 1,000 active cases around the country today, and in many jurisdictions on the numbers, no active cases in those jurisdictions. And I note Andrew Barr today has made further announcements on the basis of that. But that's not the only curve we need to flatten. We need to reduce unemployment. We need to get businesses open. We need to enable Australians to go back to work, to earn, to be able to support their families, their households, and to support the Australian economy. These are the curves that we also need to influence, and that's what success will be measured by, together with the outcomes we are seeking on health. We need to restart our economy. We need to restart our society. We can't keep Australia under the doona. We need to be able to move ahead. National Cabinet was briefed again today by the Secretary of Treasury, Dr. Kennedy, and his advice confirms the significant impact that COVID-19 is having on our economy and the decisions that have had to be taken to protect the health of the nation. There is now around 1.5 million, just over, Australians who are on JobSeeker. Over 900,000 claims have been processed in just over the past 6 weeks. This bears out the Treasury estimate that suggests unemployment rate will rise to 10% and potentially beyond. JobKeeper registrations are now over 650,000 businesses. Over 950,000 applications have been made to access super, totalling some $7.9 billion in claims. More than 340,000 businesses have received a cash flow boost under our cash flow program worth over $6 billion. 6.8 million Australians have received that one-off payment, that $750 payment, and that brings to a total of 5.1 billion of those payments that have been made, and of course another one will be made in July. There's also been, we heard today, a significant fall expected in net overseas migration, which is expected to fall by about 1/3 this year, financial year, and by 85% off its peak, or off its previous year, in the following year in 21-22. Our economic and income support programs have put a floor under our economy in these extreme times. It's all about underpinning confidence going forward. And these programs have been put in place well before these rather concerning numbers, whether it be on unemployment or business closures or others, have been presented. Despite those figures, and those figures people will be seeing in the weeks and months ahead, it's important that Australians can take confidence that there has been a clear plan to get those supports in place early, to ensure that Australia can be cushioned from an even more significant blow that we've seen occur in so many other parts around the world, not just on the health front, but on the economic front as well. And a key part of that plan going forward, as we see these shocks hit our economy, is the plan to reopen and to rebuild. The road back, which we have been on now for a few weeks. Today, the National Cabinet agreed to bring forward our consideration of the decision on relaxing restrictions to next Friday. Australians have earned an early mark through the work that they have done, and that decision will now be made on next Friday, and we'll be meeting twice over the course of the next week to ensure that we can work through the many things that have to be resolved in order to make those decisions. Our plan has been to get the virus under control and to ensure that we can contain it, to get the preparations in place for our ICU systems and health systems, and to get the protections in place, the build-up of the tracing capabilities within state health departments, the expansion of our ICU facilities, the build-up and training of our workforces, to ensure we can get the respirators in place and the access to the critical testing equipment and the tests as well as the personal protective equipment. Today they considered, at the reporting of the expert medical panel, a series of conditions precedent that needed to be satisfied in order to go forward with the easing restrictions. And 11 out of those 15 conditions have already been met, and the Chief Medical Officer will go into further detail on those. But of those that remain outstanding, there is one that Australians can do something about, and that is downloading the COVID Safe app. This is a critical issue for National Cabinet when it comes to making decisions next Friday about how restrictions can be eased. There are currently over 3.5 million downloads and registrations of the COVID Safe app, and there needs to be millions more. This is incredibly important. As I explained it the other day, it's like not putting on sunscreen to go out into the blazing sun. The coronavirus is still out there. Our numbers may be low, but it's still out there. And if we allow Australians back out into a more open economy, a more open environment, without the protection of the COVID Safe app, which enables us to know who has been in contact, how we can isolate those groups, how we can constrain and constrict that virus from getting to other people. We need that tool so we can open up the economy, and that's why it's so important. So if you haven't downloaded the app yet, download it. If you know someone who hasn't downloaded the app yet and you have, encourage them to do so. Because if you're doing that, then that is enabling the National Cabinet to be able to ease these restrictions next Friday. It's about putting the health protections in place so we can ensure that the coronavirus does not get a run on it again. Sorry. When we move to reduce those restrictions, the National Cabinet is very adamant that we want to ensure we keep moving forward. We do not want to go into a start-stop or even worse reverse process into the future. When we start opening up businesses again, that is going to require those businesses opening the doors, getting people back in, taking risks, and we don't want that to have to be reversed because of the virus getting a run on again. And that's why it's important that we get these protections in place. Kate Langbrook, I thought, put it pretty well last night when she said we've got to be like the emblems on our coat of arms, the kangaroo and the emu. They only go forward, and we only want to go forward when it comes to this. So it's pretty important that we get people downloading that app over the course of the next week. So it's over to you, Australia, as we go through this next 7 days, and we will consider that when we come together in a week from now. Now, in terms of some other important decisions that we've made today, and issues that we've considered. There was the presentation, as I flagged earlier in the week, from Christine Morgan on the National Mental Health Plan, and that's coming together, and we anticipate that hopefully that'll be in a position to be reviewed next Friday. We are also able to agree national principles for sport and recreation, and they'll be released today, and that also included a consideration of the elite sports codes. And we were also able to adopt the aged care code, and that was strongly welcomed by the National Cabinet, and that's why the Minister for Aged Care joins me today. As you know, the National Cabinet has had a very strong view about the need to ensure that its position, that it is held consistently from the advice received by the medical expert panel to ensure that Australians can continue to have reasonable access to their family, friends and others they're supporting in aged care facilities. And I want to commend Minister Colbeck for the great job he's done over the course of this past week, working with industry to establish an industry code that has been supported by the major peak aged care organisations in Australia, as well as the consumer groups in the aged care sector, and drawing together an industry code that reflects absolutely the National Cabinet advice that it adopted from the medical expert panel, which provides important access for families and other support people to those who are in aged care facilities. And so we welcome that, and we appreciate the collaborative way in which the industry has engaged with the government to achieve that over the course of the past week. Now, in addition to that, what we're announcing today is the Commonwealth will be putting an additional $205 million into the aged care sector as a one-off payment to facilities all around the country to support them in the costs that they are incurring to deal with the COVID-19 crisis in their sector. There are a range of additional costs and expenses that the Aged Care Minister has been able to identify working with the sector, and this payment is designed to give them that financial support so they can put all those measures in place. That will assist with the industry code implementation. It will keep those who are in aged care facilities safer and give their families greater peace of mind when it comes to how those issues are being managed within the aged care sector. So with that, I might hand over to Richard to go through the industry code and the announcement we've made. That brings to $850 million that the federal government has put into aged care specifically to address the issues around the COVID-19 crisis. Thanks, Richard.
Thanks, PM. And firstly, I'll go to the code, and can I specifically express my gratitude to the aged care sector for the very, very speedy way in which they've managed to pull this code together, which will facilitate visitation by residents' loved ones across the aged care sector. The concept was only designed earlier in the week, and they've done a brilliant job. So all of the aged care residential facility peaks, ACSA, LASA, Catholic Health Australia, Baptist Care Australia, the Aged Care Guild, Uniting Care and Anglicare have all signed up to this code as of last night. To the consumer organisations who also drove its design, Council of the Ageing, National Seniors, Dementia Australia, the Older Persons Advocacy Network and Carers Australia, can I thank them also for the work that they've done. I'm not sure I've seen an industry code designed as quickly as this one was, but for it to facilitate the things that National Cabinet expressed on 2 occasions now on the advice of the AHPPC is fantastic. I've had some very, very good conversations with some key players in the sector this week with respect to the development of their code and things that they are already doing to facilitate visitation of loved ones into aged care facilities. And importantly, it not only contemplates visitation for those who are at end of life, which was something that the AHPPC was concerned about, those in palliation, but also those who have had a long history of visitation, working with their loved ones, going in for meals, helping the aged care facility to support their relatives. So those people who have a history are also contemplated as part of the code. So again, congratulations to the sector. Thank you so much for the work that you've done. And can I say, Prime Minister, I think the aged care sector should be congratulated for the work that it's done in managing COVID. In this country, we have had only 23 residential aged care facilities that have had an outbreak of COVID-19. Of those 23, 15 have completely cleared it. 8 are still dealing with it, but there'll be more that will have cleared it in coming days. And that's a tribute to them. It's also a tribute to the work that the Australian community has done in managing transmission in the community, which has prevented it from getting in, but into the residential aged care facilities. But I think that's a great result. And in the majority of cases, it's been 1, 2 or 3 cases within a facility. Only on a couple of occasions have we had more. And Dorothy Henderson Lodge which was one of the first major outbreaks, is now actually COVID-19 free. So great work by Dorothy Henderson Lodge. They should be congratulated for that work. It took a little while, but great work. With respect to the announcement that the Prime Minister's mentioned for a COVID-specific support payment of $205 million across the sector. The sector will understand this more than perhaps others in the broader community, but providers across the country will get a $900 per occupied bed support payment in residential codes MMM1, Monash Model 1, so that's effectively metropolitan areas, and those in regional Australia, in recognition of the fact that they generally have higher costs, will get a 50% uplift on that, so $1,350 per residential bed. This will contribute towards the genuine extra costs that they are incurring as they manage COVID-19 outbreak. They are screening staff every day as they come and go from their shifts, particularly as they come in, so that we don't get COVID-19 into the facility. That takes them time. They will be screening visitors as they come into the facilities to ensure that we don't get COVID-19 outbreaks. They've suffered additional costs in things like personal protective equipment because it's been so rare and prices have gone up, so they've had some other costs that have increased as well. And of course, just in some of their other everyday work that they've been doing, they've had additional costs. So this measure is in recognition of those additional costs in managing COVID-19. And as the Prime Minister said, that takes the total amount that the government's put in specifically for COVID-19 up to over $850 million, which is a significant amount of money. Thanks, Ben.